Good morning, everybody. Welcome. Thank you for joining us. I'm Jonathan Heller. I'm a Senior Health Equity Specialist with the National Collaborating Center for Determinants of Health. I'll be presenting today with Diwa Marcelino, who's an organizer with Migrante Manitoba. Diwa will tell you a bunch about his and their inspiring work in a little bit after I do some more theoretical stuff and a little bit of housekeeping up front. Just to introduce NCCDH, we are part of a federal program, the National Collaborating Centers for Public Health, funded by the Public Health Agency of Canada. The National Collaborating Centers for Public Health promote and support the use of knowledge and evidence to strengthen public health practice, programs, and policies in Canada. There are 6 national collaborating centers across the country, each of us focused on a particular domain of public health. NCCDH is located in Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq people, now known as Antigonish, Nova Scotia, and we're hosted there by St. Francis Xavier University. NCCDH in particular is focused on a vision of getting to a world where all people and communities experience a dignified and healthy life in relationship with each other and the planet. And our work, as our name suggests, focuses on the determinants of health, and in particular, the structural and social determinants of health, and advancing health equity for all. The content that we're covering in this webinar today is very similar to content that we covered in a similarly named session at the CPHA conference earlier this year. Similar objectives. We want to explain community organizing as a public health intervention to address the structural determinants of health and advance health equity. We want to describe examples of public health partnering with community organizing groups and using community organizing methods to advance health equity. And we want to begin to unpack actions you can take to integrate community organizing into the public health interventions you're involved in. Agenda-wise, after this intro, I will start by introducing community organizing. I'll talk for maybe about 20-25 minutes, and then Diwa will come on and in particular focus on the work that Migrante Manitoba is doing as a case study of community organizing. I'll talk a little bit more about roles that public health can play when partnering with organizing, and then we'll have time for a Q&A and discussion at the end. All right, so to get us going, I'm going to start introducing community organizing, and I'm going to start a little bit on the theoretical side, connecting the need for community organizing with our understanding of the structural determinants of health and power. I'm going to try and move through this content pretty quickly so that we can focus on this introductory content pretty quickly so we can focus more on the organizing content. So buckle your seatbelts, folks. Okay, so start with some basics just to make sure we're all on the same page. These definitions are on the NCCDH website. We've got a glossary there. We think of health as more than the absence of disease. It's physical, spiritual, mental, emotional, environmental, social, cultural, and economic wellness for individuals, families, and communities. Health inequities are differences in health rooted in social, economic, and environmental conditions and in power imbalances, putting groups who are already experiencing disadvantage at further risk of poor health outcomes. And we think, following others, that health inequities are predictable, systemic, avoidable, and unfair. And I'm going to come back to that in a minute. And then health equity is when all people have fair access and to opportunities to reach their full health potential. So if we think about inequities, one of the things that we just said on the previous slide is that they're patterned, right? And so this is a recent map of the working poor in Toronto. On the top left is the original map. But the point here is that if you look at many different demographics and outcomes, you'd see very similar patterns. If you looked at income or unemployment, education levels, crime, different health outcomes, just you name it, we tend to see pretty similar patterns. These patterns are created by what are known as social structures. And we're sharing this because when we think about the structural determinants of health, that word structures has this meaning that the structures are the things that these social structures are the things that create these patterns that we're seeing. These patterns are durable, meaning they continue through time and they're hard to break, even though we try and intervene. They're hierarchical in that some parts of the city or some parts of the country are always doing better, and others seem to always be doing worse. And while we're showing geographic patterns here, there are also hierarchical patterns and durable patterns that are based on other attributes like race or income or other factors. Again, the same groups always seem to be doing well, and a different set of groups seem to always be doing less well. The things that create these patterns, as I said, are social structures. So another way of saying this is that we see patterns in community conditions or in the social determinants of health. So here I show the original World Health Organization definition from 2008 of social determinants of health. They are the non-medical factors that influence health outcomes. They're the conditions in which people are born, grow, work, live, and age. And importantly, the World Health Organization pointed out that they're also the wider set of forces and systems shaping conditions of daily life. These forces and systems include economic policies and systems, development agendas, social norms, social policies, and political systems. But what happened pretty much immediately in Canada, in the US, and around the world is that this concept got depoliticized. While that sense of forces and systems is in the original definition, it got simplified. And so, for example, just a couple years later, the US CDC referenced the World Health Organization definition, but simplified it to just say it's the conditions in the environments in which people are born, learn, work, play, worship, and age that affect a wide range of health functioning and quality of life outcomes, right? So they depoliticized it. They took out the things that cause these conditions to be, that create these conditions, and somehow now miraculously these conditions just exist. And because of this depoliticization, public health academics, practitioners, activists who are focused on equity have increasingly been talking not about social determinants of health, but about structural determinants of health. But the definition of structural determinants of health hasn't been super clear. And so about a year ago, we released a paper. I work part-time in the States and part-time in Canada, and we released a paper through my work in Wisconsin that defined the structural determinants of health based on what I just explained to you about social structures. So we define the structural determinants as the written and unwritten rules that create, maintain, or eliminate the durable hierarchical patterns of advantage between socially constructed groups and the conditions that affect health that I was just talking about. So there are a set of rules that create, maintain, or can eliminate these patterns. And importantly, and this is both, the structural determinants are also the manifestation of power relations in that people and groups with more power based on current social structures work to maintain their advantage by reinforcing or modifying these rules. So it's a set of rules and how they're enforced by power dynamics. What kind of rules are we talking about? There's values, beliefs, worldviews, culture, and norm. Those tend to be less written rules, more of the unwritten type of rule. Governance, or the way our societies organize themselves to make decisions, how we manage our economic and political and social affairs through interactions within and among the state, civil society, and private sector. Laws, policies, regulations, and budgets, more of the written kinds of rules, and institutional practices. There are these two components, the rules and power dynamics, right? And so when I think about this, I think about this reciprocal relationship between power and the rules. People who have power are the ones who can set the rules, and the rules then determine who actually has power, right? And that relationship then, if we want to change the rules, means that we need to change who has power. And we can do that by building power in communities that are facing inequities. And we can do that by breaking the power of those who currently have it and are using it to maintain the status quo. These written and unwritten rules, these structural determinants and power dynamics also enshrine and encode structural oppression. So I'm not going to go through all of this, but on the left-hand side of this table, you see the different kinds of rules that I just mentioned, values and beliefs and governance and laws and policies and institutional practices. And on the right are different forms of structural oppression and the rules that create different forms of structural oppression. So on the top line is in red is structural racism, and the blue line in the middle is structural sexism. On the bottom line in orange is structural economic exploitation. And so just to give an example of the kinds of beliefs and worldviews that create these things, if we think that whiteness is superior, that creates structural racism. Men as superior, that creates structural sexism. And the belief that if you just try hard enough, you can make it is a rule that creates economic exploitation, structural economic exploitation. These kinds of rules, when you think about it this way, you can also think about intersectionality. These rules affect people with different identities differently. So if you are a low-income Black woman, you might be facing all of these different kinds of rules that basically cause inequities. If you're a cisgender white male like me, you face a different set of rules or fewer rules that do this. That create the inequities that lead to inequities. So we can also think about changing these rules, and there are many changes over the last decades in Canada and around the world that have led to less inequity. And we can think about voting rights and women's movements and the fights that have been around that, and progress on gender issues. All of these kinds of things have been changing the rules so that we have less inequity. So the point of this then is that if we want to advance health equity, we need to change community conditions. That means we need to change these written and unwritten rules, which means we need to shift power relations by building community power and breaking the power of those who maintain the status quo. So that leads to the question of what is power? And power is not a concept we talk a lot about in public health. It's a concept that I think many of us feel is like, we think about it as controlling or unethical, and so we want to distance ourselves from power. But as Dr. Martin Luther King said, power is the ability to achieve a purpose, and whether or not it is good or bad depends upon the purpose. If our purpose is advancing health equity, our purpose is good, and we actually need to understand power and use it in ways that actually advance health equity, that help us reach our goals. So we also can feel very powerless in public health. We feel like we don't have the resources we need to do our work. We feel like there's scarcity. And while that can be true, we also are not completely powerless. And we can partner with community organizing groups to help them build power and to build power alongside them. So that's what we'll be focused on. There are frameworks that help us shift our thinking about power. So it's not just this idea of domination or control, but feminist scholars and activists have reframed power to think about power too, like the power of an individual to act, their ability to act, or communities coming together and having the capacities, the capabilities to achieve their ends, or power with collective action. That's really what we'll be focused on today, building power together to achieve our goals. Building alliances across groups to achieve common goals, and we can think about power within, or basically a sense of self-worth and agency that allows us to act as well. So, the way I think about this is in the current world right now, if we think about the power dynamics, corporations have a lot more power than communities that are facing inequities. That leads to a set of rules that are both exploitative and extractive, and it leads to corporations profiting and thriving while communities are getting sick and suffering. If we think about trying to build community power and break corporate power, we can change the rules, change the power dynamics, so that communities have power. The rules end up being more focused on creating well-being for people, and we end up with an economy that serves people and communities that thrive. So the way to do this is through one important way to do this is to community organize. Okay, so that's what we're talking about. That's the lead into what is community organizing and why do we care about community organizing. So I'll go through some content that is in a couple places. One, a rapid review that we released earlier this year, and two, Let's Talk on community organizing that we also released this year. So a lot of this content is in documents that you'll find, and you'll see those resources coming up in the chat as well. So we define community organizing, building off of what others have written, as the processes by which people who have a common identity or purpose unite to build relationships, to identify shared issues, to collectively analyze those issues to understand the structural injustices that underlie them, to develop collective goals based on that analysis, and then to implement strategies and tactics to reach those goals. And those strategies and tactics can include leadership development, activating members for direct action and campaigning, expanding group membership, base building, and building power among the group and broader community to influence decisions and set agendas and shift worldviews. Central concepts to community organizing include building agency and power, increasing community members' sense of control of their own lives, their ability to take action, developing critical consciousness, so in developing the ability of community members to critically reflect and hold complexity through dialogue and action, including understanding the structural roots of the individual struggles that they're facing. Another concept is base building, expanding the number of people who are involved, and therefore building our power. Building community capacity, so building the capacity of community members to identify, mobilize, and solve problems in their communities and to take leadership in doing so. Leadership development, I think of that as moving from private individual shame, isolation about the problems somebody faces to a public stance about those problems. Issue selection, meaning going from problems that we face to solutions. What are the specific targets that we can change? How do we unify our base around, through campaigns to make change? We run campaigns, organizers run campaigns to make demands and take actions to achieve the changes we're seeking. And often community organizing involves forming an organization, so we're building institutional durable power. Organizers focus on power a lot in their work. It's I think what distinguishes organizing from many other fields. When they're running a campaign, their question is always, how is this going to help us build our base and build our power? And so one of the questions that they'll ask when you approach them or if they approach you is, how is partnering with public health, working with public health, going to help us build our power? So that's something to keep in mind as you think about working with organizers. Just to point out the other side of things, there are many other important things that civil society does, different kinds of organizations that are not community organizing. And just to name a few of them, there are organizations that focus on policy and systems and environmental change, but they don't necessarily think about power so much. They don't have a base of people. Those are all of these things are important to do, but they're not organizing. So I'm not trying to belittle any of these. I'm just trying to point out the differences. We have a lot of education organizations and service organizations that don't think about having a base or building power or making change, just providing services. Those aren't community organizing. Lots of different kinds of coalitions and councils and partnerships out there, policy or advocacy organizations that don't have a membership base. Some buildings, for example, have a residence council that the owners of the buildings, the management of the buildings puts in place to lead the work. Since that's not really grassroots, it's really put in place, and the locus of power is with the management. That's not really organizing either. And then there are lots of cultural and ethnic organizations that do service provision or advocacy, doing great work. But again, if they're not thinking about building a base and some of these other aspects, they're not organizing. And then last couple slides I have are some of the tools that organizers use. They will do, they're very relational focused, building relationships between people, and they use one-on-one meetings to and house meetings to do that. They are trying to build relationships, find points of connection. They're trying to understand what people's frustrations are, their self-interests, what their drives are, so that they can identify what's going to motivate somebody to come to a meeting and start to organize together with other people. They bring those people together in house meetings to break some of that isolation that I talked about earlier, so that people can see that, you know, if they're having a housing problem, that's not their fault. It's not just them. There are lots of other people in the community who are having that same problem. And then agitation. Organizers will try and push people to take more leadership. And when that's done well, it inspires somebody to dig deeper and strengthen their commitment to making change. And then another kind of meeting organizers will do is research meetings. So they might come to you to understand what power does public health have? What data does public health have? How can public health contribute to the work that we're doing that the community has already identified? And then other tools, they move from problems to issues to solutions that they want to run campaigns on. They do political education, the collective process of study, research, analysis, and learning to develop the critical consciousness of community members, so that they are focused on structural issues. They do a lot of leadership development. They do power analysis to understand the power dynamics related to a particular issue they're running a campaign on. They have these issue campaigns, they run campaigns, and a lot of their tactics are often nonviolent direct action. They're methods of protests, of non-cooperation and intervention that basically create conflict, not violent conflict, but conflict, with the goal of making change. And these feel like they're important because the systems that we have are set up to maintain the status quo. We need to confront those systems in order to make change often. So with that, I'm going to pass it over to Diwa, who is going to take a lot of those concepts I just covered and make them a lot more concrete and real.
Thank you, Jonathan. Pleased to be here to talk about the work that my organization, Migrante Manitoba, does. I'm coming in from Treaty 1 territory in Winnipeg, Manitoba. So welcome for everyone coming from different areas of the country. I want to just briefly talk about the work of Migrante Manitoba, specifically the work we've done in the past 5 years. I want to highlight the issues, the victories, the complications, and the struggles that we've had over the past 5 years, specifically talking about the pandemic and our work there. And I want to talk about how our organizing is one of the only models that we think of when we talk about the real change that we want for groups like Migrante Manitoba who work with migrant workers. Next slide, please, Jonathan. I'm very proud of this photo. This photo was taken in 2021. This is one of our AGMs for Migrante Manitoba. Migrante Manitoba, I'll briefly describe. Our mission is to advocate for and organize migrant workers in Canada, especially those in the temporary foreign worker program, but also those who are undocumented or here on different statuses. Our focus is on improving migrant workers' health through addressing structural determinants like poverty, exploitation, and lack of rights. We do this by organizing ourselves, developing leaders among our organization members, and also tackling the issues that we face as a collective rather than individually. So I'm going to talk about how organizing improves our health and well-being for migrant workers in this case. I'll talk about collective action, education, and the solidarity it takes to tackle the systemic issues that affect migrants' health. Just a little bit more about this photo. Almost all of our organization members are temporary foreign workers themselves, or recently new immigrants or provincial nominee or citizens. So the work that we do is all volunteer, and it just shows the power of community organizing and the power of relying on workers themselves to find their own power and fight these injustices wherever they are. Next slide, please. So just briefly about our programs. We do rights and welfare work. Sometimes it could be considered as service-oriented, but Migrante tries not to do that. A, because we don't have the capacity, we don't have funding, we're all volunteer-based, as I said. But rights and welfare, taking on different cases or referring folks to different agencies that they can get help, is a huge part of how we receive our data. We have informal forms of quantitative, qualitative data that we often use to inform our work, our campaigns. It might not be the type of academic data that you may be used to in academia or in public health, but we do have data. And what I'll talk about very soon is how this data is often not utilized by folks in the government or in public health. We also do campaigns and advocacy. One of our campaigns is to give more rights to migrant workers. We also have a campaign that stems from the Philippines to increase the minimum wage of workers in the Philippines. We, as an organization, not only fight for the rights of welfare of migrant workers and their families in Canada, but also we try to address the root causes of forced migration. And in our case, many of our members are from the Philippines. So we often look to the Philippines so that we look at the root causes of forced migration, in addition to the advocacy and policy work that we have here in Canada, trying to make improvements in federal legislation and provincial legislation. One other crucial part of our work is education and research. At first, even myself, when I started working with migrant workers almost 24, 25 years ago, I didn't know the real impact that research had. Partnering with professors and universities and organizations is essential in getting that informal data that I spoke of, that we have in the back of our heads or in our Excel sheets that we track, or in our casework. This data, when we were able to publish journals and reports, when we were able to get this data verified by our different organizations working in the universities, we're able to further our policy work, further our advocacy. We are able to really support those victims of exploitation by getting their stories heard, not only at an individual level, but also at a level where public policymakers can really take note of the trends, some of them universal trends, especially with the temporary foreign worker program, which I'll discuss. We also do international solidarity because we are focused on the root causes of migration. Often we talk about, in our education and political empowerment studies with our members, we talk about imperialism, whether it be climate imperialism or colonialism. We talk about issues of capitalism, neoliberalism. All of these programs are very essential to build a leadership base that can fight for their rights and look to the root causes to attempt to attempt to look at the root causes of our forced migration. Next slide, please. So Canada's Temporary Foreign Worker Program. So the temporary foreign workers in Canada are critical to industries like agriculture, hospitality, caregiving. But under this temporary foreign worker program, where Canada gets tens of thousands and hundreds of thousands of workers to come from different countries like the global south to Canada to work on a temporary basis, and often with a closed work permit or visa, they often face precarious working conditions because they are temporary. Even though they can be here for years and years at a time, most migrant workers are, by definition, not permanent residents, making them vulnerable to exploitation. They are often excluded from healthcare, and they also lack labor rights, whether in legislation or effectively because of lack of enforcement that's done in the province in Canada. So what are the challenges that these workers face? Unsafe working conditions. But they also face the structural barriers like poor living conditions, unsafe work environments, low wages. These structural factors are key determinants of their overall health and well-being. Things like no sick days. These are the type of systemic inequalities that really reared its ugly head during the pandemic, which I'll discuss. Next slide, please. Forced migration and the structural determinants of health. When we try to understand forced migration, we look at the root causes, chronic poverty, political instability, corruption in countries like the Philippines lead many to migrate for economic survival. Forced migration is not an individual decision, but it's the consequences of global economic systems as well as local governance failures. That's why in our political education studies and our seminars that we have for our migrant workers, we need to actually be experts in these structural factors, these global economic systems, because this leads to our forced migration. And then host countries like Canada, which host migrant workers, the effects of these structural factors really bear down on our health. Next slide, please. I want to talk about now the power of working together. This photo is part of a series of consultations that we've done with the community. As you saw in the picture, there was about 20 or 30 folks there from Migrante. We only number about 50 to 70 people usually at any given time, but the community access that we have when we do community consultations and when we include our allies, when we include adherents who are non-members but closely linked to Migrante, we do have quite a powerful army. So when we organize all these folks together, our allies, our accomplices, our members, we do see the power that we can achieve to affect change. So organizing workers and creating collective action helps to address the root causes of health inequities. Collective organizing allows migrant workers to challenge policies and practices that perpetuate poor working conditions and exclusion from services like healthcare. So how does collective action improve health? When migrant workers unite, they gain the power to advocate for their better living and working conditions, fair wages, and access to healthcare, key determinants of health. By empowering communities and by understanding their collective power, workers can advocate for policies that directly impact their health, well-being, and such as the access to affordable healthcare and the access to labor protections. There's one thing that was on the news talking about artificial intelligence that really made me think about migrant workers and workers really empowering themselves and achieving their full leadership qualities. the AI singularity, which is a term recently talking about when AI achieves a prowess that they will be unstoppable, or how AI will become more intelligent than human beings. When I think of that AI singularity, I think about the singularity that happens within the workers that we organize with the collectives and the organizations that we work with all across Manitoba and all across Canada. Once workers achieve their consciousness that Jonathan was talking about before, when they realize that together they can actually change, they're not stuck in their isolated workplace. When they connect with other workers and start to organize in a very intentional way, this point in time, I'll call it the singularity because it reminds me of the AI singularity. That is a time when workers can unleash their full power. I have a case study at the end of this slideshow that'll talk about what happens when workers achieve that so-called singularity and understand their true power working as a collective. Next slide, please. Rights workshops. The role of employment rights workshops. Education is key to empowering migrant workers, and Migrante Manitoba workshops teach workers about their rights, including wage laws, workplace safety, and labor protections. These workshops also emphasize the link between workers' rights and health. A worker who knows their rights is better able to secure safe work environments for themselves and their coworkers, and they also be able to advocate for fair wages. How do these workshops build collective power? Our workshops serve as organizing hubs. We gather workers to share their experiences, address common challenges, and build solidarity. Workers are encouraged to form support networks and take collective action to demand their rights and improve their living and working conditions. Our goal for mobilizing for change is to move from awareness to action, where participants feel empowered to join organizing campaigns and demand structural changes. A little bit more about these workshops. The key part of these workshops is not actually knowing about the rights themselves, actually. It's very important to learn about your rights, but when workers group together and share their stories, they understand that they're not alone. And that's the biggest thing that these rights workshops, or any gatherings that we have, any organization exists to solve a problem. And once you are linked with other folks who have similar problems than you, it lightens the load, at least psychologically, but also it lightens the work that you need to do because of the collective power and collective actions. Next slide, please. This is a photo of our chairperson at the time, who was a migrant worker. He recently received his citizenship, thankfully. This was taken in 2021 during the pandemic, the COVID-19 pandemic. And in Manitoba, we did several campaigns during the pandemic. I'll talk a little bit about a campaign that we had called Kapit Bisig, which means linking arms in Tagalog. The pandemic highlighted the vulnerability of migrant workers who face health risks. They had job insecurity, and they had exclusion from essential services like healthcare. Migrante Manitoba responded by participating in the Kapit Bisig campaign, providing emergency relief, support, and community empowerment. One of our initiatives was to have emergency grocery hampers, distributing essential food and supplies to migrant workers who lost their jobs and those who were unable to access government aid. If we recall, during the pandemic, I remember there was a lot of talk about being bored or not having anything to do, but that was a privileged section of our society. Those folks, many people of color, many members of the BIPOC communities, were essential workers, and they were on the front lines, and they had the brunt of the pandemic. I believe there was a report from Public Health in 2021, which showed that Southeast Asians and also Filipinos in particular were most impacted by COVID-19. For Southeast Asians in Manitoba, they were 21.7 times more likely to contract the virus than a white man. So if you look at the structural inequities, that's always has been a glaring example of why we need to listen to workers. We need to educate, empower workers, because they're often not in the halls of power. They're not in tables where they're talking about public health responses. They should be, or at least they should be consulted, but they are not. These emergency grocery hampers and distributing essential food was also a way for us to organize workers. Like I said before, we don't really do service delivery like traditional NGOs. Because we are grassroots community organizers at heart, we essentially seconded 2 members of Migrante during the pandemic to organize workers themselves. And during that time, these 2 workers, myself and another colleague of mine in Migrante, we were able to organize other workers. So we didn't, because we're doing this on a part-time basis and working on the weekends to do this, we were able to create capacity where there was none. We were able to really plan, operate, and successfully deliver this Kapit Bisig emergency hamper campaign. We were able to also coordinate efforts to have folks referred to vaccination clinics to ensure workers could have access to COVID-19 vaccines. We were able also to encourage folks to refer them to our employment rights workshops to continue to educate workers. And we were also able to refer folks to professional services. So our foot in the door was groceries, but we were able to start the pipeline from having migrant workers be alone to realizing that they are part of a bigger campaign, a bigger projects where they can affect more change. So this campaign did provide immediate relief while also raising awareness about the intersection of labor rights, healthcare, and migrant justice. Next slide, please. So again, this is a picture of our volunteers that we were able to work with. Almost all of our volunteers were migrant workers themselves. It was a very difficult time. There was a lot of social distancing enforcement involved. We weren't able to meet, but thankfully, we were able to do so much during this time. Folks who did not have access to CERB, for instance, were complaining that they didn't have enough food to eat. Folks who were in the hotel industry, the service industry, who lost their jobs, who didn't have access to EI, who didn't have access to CERB, they had nothing to rely on. Migrante Manitoba, like other organizations, took part of this program, Kapit Bisig. There's a website, kapitbisig.ca, and really was able to create a group almost from nothing. We went to different communities. We distributed our leaflets. We referred folks to legal services, to immigration services. We were able to collect survey responses along the way for workers. I believe we did over 800 to 1,000 intake forms where we were able to get a lot of rich data about where people were at, how they were affected by the pandemic. It was very unequal. There were some folks who were forced to work, like those in the meat processing facilities. There were also people who worked in the hotels, as I said, and they didn't have any work. So there was a wide range of experiences among migrant workers. Next slide, please. So as I said before, the Capit BSIG campaign not only provided short-term aid, but also contributed to long-term resilience by helping workers organize and access necessary services. By strengthening workers' ability to demand better conditions, we helped create sustainable improvements in their health. We had long-term relationships made with organizations such as the Aurora Family Therapy Center, now called Resilia, the Manitoba Association of Newcomer Serving Organizations, which includes most of the immigrant settlement services in Manitoba. We were able to make inroads and further our relationships with the Institute for Global Public Health with the University of Manitoba and the Institute for Global Public Health, and also the Winnipeg Interdisciplinary Student-Run Health Clinic, WISH. We also were able to highlight different inequities experienced by these workers in the pandemic through news articles, through press conferences. We were able to make many gains during the pandemic, which I'll show you. Next slide, please. So talking about research and our advocacy, there's a strong importance with research that I mentioned before. Collaborating with academic institutions and other research partners allows Migrante Manitoba to collect data on the living and working conditions of migrant workers, which is essential for effective advocacy. This advocacy is strengthened through the research, which legitimizes our work. It provides the evidence that we need for change. It strengthens the case for policy reform and helps push for better living and working conditions for migrant workers. These are some examples of the collaborations with researchers. We had a research project with Dr. Anthony Nguyen, Serday Shaw, Lisa Lazarus, and Robert Lowe with the University of Manitoba. During the pandemic, we specifically looked at, through a CHIR grant, looking at the barriers with vaccine uptake. We were able to interview hundreds of workers. We were able to gather all their stories about the difficulties they've had during the pandemic, including not being able to access the COVID-19 vaccination. Very basic remedies to the COVID-19 pandemic, and they didn't have it. We were able to use this research, which led to public awareness campaigns, which led to bolstering the rights and welfare of migrant workers. In one case, in June of 2021, we were able to, because of the access to workers that we had and because of the research advocacy that we did with these workers, we were able to highlight that workers still in 2021, when most folks had access to the vaccine, we were able to find out that a majority of migrant workers, especially those in the seasonal agricultural worker program, which is mostly migrant workers, migrant farm workers from Mexico and the Caribbean, we were able to find out that they had huge barriers to get the COVID-19 vaccine. Another project that we did was with home care workers. This was done simultaneously with the CIHR vaccine uptake project. We looked at the plight of migrant and immigrant and newcomer home care workers in Manitoba. And as we know, with the pandemic, many health professionals, like home care workers, were essential. They had to work, but they were also disproportionately affected, and the virus was transmitted to health workers at a disproportionate rate. So this work also reinforced the different trends that we saw across Manitoba among migrant workers, and how they were at a systematic level hampered by either actual legislation or by other barriers in policy or in practice that really cost people's health and in some cases their lives. Next slide, please. This is a case study that Migrante has been involved with for almost a year. They include migrant workers who came during the pandemic. And this news article, if you go to the next slide, Jonathan. This news article just came out last week, and I'm really pleased to announce that after working with almost 7 migrant workers, but only 3 of them were able to register a complaint with the Manitoba Labor Board. We were able to win against a very well-funded boss, employer who exploited these migrant workers for the last few years. These workers were made to pay for fees that are illegal to be paid for, such as airplane fees. They were made to work for free, basically slave-like conditions, like the UN Special Rapporteur announced in Canada, I believe last year or the year before, calling the temporary foreign worker program in Canada breeding ground for modern-day slavery. 2 articles in the Winnipeg Free Press that I've highlighted here really show the power of these workers who were unrepresented, who are up against a well-known employment lawyer and an employer who probably spent over 6 figures, 100,000 or more, on this case, trying to quash it. These workers not only fought for their rights and won, they did it mostly by themselves. Because Migrante Manitoba is a volunteer base, I myself, I have a full-time job for my economic needs and my family needs. If we were able to, even at a full-time level, advocate for these workers, I don't think that we would achieve these same victories. Because of our organizing approach, our empowerment approach for developing leaders, developing workers, and educating them, we unleash the power of these workers. If you can go back to the previous slide, Jonathan, so I can, these, not the guy in the middle, that's me, but the workers behind and the workers beside me, they were able to build their own case, develop an evidence database. They were able to articulate themselves. They were able to go tit for tat with the lawyer, represent the employer, and they were able to prove that they were fired and that the employer was guilty of contraventions of the Labor Relations Act of Manitoba, which is illegal. The specific part of where the employer ran afoul was when these workers were experiencing the exploitation, they complained to the federal government's tip line. Specific tip line was the Employment and Social Development Canada Department of the federal government, which governs the temporary foreign worker program. And 2 weeks after, within 2 weeks after they made this tip to the government, they were fired. That was because the workers, after going to the government, they were able to get their open work permits for vulnerable workers, but their investigation led the employers to seek vengeance against them and retaliate, which is against the law in Manitoba. And subsequently, after almost a year of fighting and a year in the Labor Board hearings, they were able to prove, and hopefully this case is still ongoing, so there'll be more news about this, but hopefully we'll receive a judgment and get some justice for these workers. But I'm proud to say that these workers, which are in Thompson, Manitoba, which is 8 hours north of Winnipeg, they were able to use their skills and their collective power to really achieve this landmark win, and show the power of organizing. And there's more to come in this story. I think there's one more slide. Yeah, so just to summarize, Migrante Manitoba's organizing efforts are really focused on improving the structural determinants of health for migrant workers through collective action, education. We use our strong partnerships with researchers, with organizations, with allies. These relationships are key to empowering migrant workers and improve their living and working conditions. I'd like to thank Jonathan and the folks at the NCCDH for allowing me to speak about this important topic about grassroots organizing and how it leads to worker empowerment and how that leads to improving our health. Thank you.
That was amazing, Dua. Thank you. You're getting lots of love in the chat and everywhere. So thanks for sharing that. I'm gonna spend a little bit more time talking about how public health can partner with community organizing groups, building on what Dua just introduced in terms of some of their work. I'll remind you to add any questions that you have into the Q&A box. If you have, there are some in there that we'll come to in about 10 or 15 minutes, but feel free to add more questions. Okay, so what can public health do to partner with organizing groups? So we did a rapid review of the literature around community organizing and public health. The references down at the bottom of the screen. I think we'll put it in the chat as well. The literature has some examples of public health partnering with community organizing groups and using organizing methods, but it's really, I would say, an underdeveloped area of practice for us. The aim of the rapid review was to uncover benefits, challenges, and outcomes of governmental, nonprofit, and academic public health, partnering with organizing groups and applying community organizing methods. We did it was rapid, and so we limited the searching to community organizing, and we didn't include things like community developed, which would have kind of blown up the scope of this. So it's very specific to people who use that term. Some of the things we found, and just have a couple slides on this, the interventions that we saw in those papers, there were 24 papers that we found, that public health was working explicitly to build community power. They were partnering with organizers and or using organizing methods as part of their research processes, including CBPR type projects. They were partnering with organizing groups outside of research for their expertise, to bring the community in to weigh in on topics and to guide programs. Public health was using organizing methods to build its own power to achieve its health equity goals. There were cases where public health was hiring organizers to engage impacted communities to address health inequities, training or supporting community members to organize, which is something I think we could do more of. Training itself to use organizing methods to build a capacity, to build our capacity as professionals, so we could actually organize within public health to change what we do and our structures, and training itself to partner with organizing groups. We saw a lot of different outcomes in this as well. Some of the benefits, a lot of the papers referred to increased public health effectiveness, that it changed the priorities of the health department, or the public health department, or the community organizing groups. This work built community capacity and built community power. It enhanced data collection and research a lot. We were already getting some questions about engaging with organizers in the chat. A bunch of the papers indicated that they had won policy change through these collaborations, and that it increased social capital. Some of the challenges that we saw were administrative barriers. it's hard to, for example, contract with organizing groups sometimes in the bureaucracies that we work in. Differences in approaches, differences in language, power-centered approaches versus much more evidence-based, quote unquote, objective types of approaches were getting in the way. And then we saw challenges just related to community organizing broadly, that it's as Diwa explained, it's something that people are doing on a volunteer basis. It's very labor intensive. It's not well resourced. And so just there are challenges when public health is trying to work with organizing groups. We are writing a practice brief around what public health can do, so look forward to sharing that with you in not too long. That covers roles that public health can play in supporting organizing based on the 4 broad roles that public health has already been described as playing. In terms of assessing and reporting, we can assess and report on the existence of injustices related to the issues that the members of community organizing groups, we can, using Diwa's example, the injustices related to, the hiring practices and firing practices and economic exploitation. So we can basically focus our data on those kinds of things and on the effective strategies to address those issues. We can modify and orient interventions. We can modify, orient, transform our own interventions to address the root causes that community organizing group members are facing, that they would prioritize rather than what we would prioritize. We can partner with other sectors, obviously partnering with organizing groups, co-developing and implementing strategies to address issues that the communities prioritize. And we can participate in policy development. We can co-lead, we can support and participate with community organizing groups and their members in policy analysis, development, advocacy, implementation, and evaluation. I'll just wrap up with a few just quick case studies. There's more written about all of these that you can dive into if you want to. In the US, I worked on a project where we partnered local health departments with local community organizing groups in their jurisdictions. In this case, we partnered Santa Barbara Public Health with Cause, also an organizing group that focused on migrant farm workers. The farm workers were fighting for toilets and clean water in the fields, and the public health department built a relationship with them over the course of a year and supported that campaign, doing things like surveys of the fields, the different growers, to see what access the workers already had to toilets, using our convening power to bring together different groups, the organizers with the growers, with the Agricultural Commission. So they did work like that as well that helped build the organizing group's power. And these relationships were developed before COVID and became super vital during COVID around the issues that these migrant workers were having in housing, in the congregate housing they were living in. Another example here, mostly in Toronto, the Decent Work and Health Network organizes health workers and trainees to advocate for better health by addressing working and employment conditions in Ontario. They work with the Workers Action Center and Justice for Workers, other organizing groups, and they have won paid sick days legislation over COVID and increased minimum wages to improve the health of precarious workers and healthcare workers and many others. So you can read about their work as well and go to their website and check them out and join as well. And then the last example I'll share is the Parkdale Queen West Community Health Center. Their health promotion folks saw nail technicians coming into the clinic presenting with very similar conditions. They then held focus groups and a roundtable with those nail salon workers and started this nail salon workers project. The nail technicians decided that they wanted to organize through the Nail Technicians Network, and the Community Health Center hired an organizer to support that organizing work. they also built a broad cross-sector coalition that included academics and clinicians and legal clinics and the workers themselves to support the organizing and address a broad array of issues, starting with the chemical exposures, but then going on to work on things like wages and working conditions and migration issues. So again, there's a case study you can read about this as well. Just to show a bunch of these things, I think most of these, all of these have been shared in the chat by now, and we'll share all of those after the webinar. But we have a Let's Talk on community organizing, a Let's Talk on power, and a Let's Talk on determinants of health, and a Let's Talk on community engagement for public health. All of those are content, include content that we've covered today. We've got specific things around Public Health Speaks about public health folks, with public health folks talking about the organizing work that they've been doing and involved in. We've got a case study of that nail technicians project I just mentioned, and a case study of the work that the Decent Work and Health Network does. And then the US spent a lot of time talking about decent work, and we've got a decent work issue brief and practice brief as well. And we also have a podcast, Mind the Disruption, that talks a lot about working conditions, and there's specific episodes on disrupting gig work and disrupting migrant work. So with that, we'll go to Q&A. I see some questions in here, and we'll come to those. I'll come off screen share in a second. But questions that we'd love for you to respond to in the chat, or I guess in the chat, is what organizing groups work in your jurisdictions, or on the issues that you work on, and how do you think you could partner with them? And then a second question is, should public health in Canada itself organize, and what could we change if we did that? All right, so those couple of questions, I'll throw those into the chat in a minute. And just last slide, and then I'll take it off screen share. If you want to connect with us, there is how you can do it. Okay, as I said, if you choose to leave now, or when you choose to leave, there's going to be an evaluation, so please fill that out. And I am going to stop screen share. There we go. All right. Thanks, everybody. So, Do, I already see some specific questions for you in here. Do you want to talk a little bit about if you've done any work around meatpacking in the pandemic, and how you connected with others who do that work?
Yeah, for sure. So during the pandemic, actually, the majority of the work we did organizing different workplaces was with meatpacking. As you may know, in North America, but also in Manitoba, the start of the pandemic, the really huge outbreaks happened in the meatpacking industry. In Manitoba, it started in Brandon, Manitoba, at the Maple Leaf plant. I'm going to be a little bit harsh for public health folks, but public health, still using their droplet theory, really denied the huge amounts of data that we were able to gather from workers, saying that, we are not getting this from work. We were spreading it to our families at home, which was emphasized by public health at the time, that it was being spread in the home, but it disregarded actually where it came from in the first place. It was in the workplace, where the meatpacking industries, where people were working shoulder to shoulder and transmitting it because of the airborne nature of the virus. So that's something that I think needs to be said, that workers' voices and the data that we have should be regarded as a very strong primary source. Unfortunately, it wasn't, and people's lives were affected ultimately by that choice. So yeah, we did work with folks all across Manitoba, mostly in the temporary foreign worker program again, mostly in pork, but also chicken and turkey manufacturing. And this is where we found folks, like that statistic about almost 22 times more likely to get COVID. That was mainly because of workers working in meat factories, these BIPOC community members who were subject to really close working conditions, no sick days. They didn't feel like they were able to get their days off. They're afraid about their boss being mad at them because they're taking time off, because they only had one employer, because they were wishing to get permanent residence. So yeah, much of our work, especially the vaccine uptake, happened with migrant workers in the farms, but also in the meat packing industry.
Great, thank you. A couple more for you. Two questions. One, did the workers receive back pay or compensation for what happened to them? I think you might not, you're in negotiation around that, but you can say more. And then the other question I see in here for you is, how did the MFL OHC's cross-cultural community development program help your work?
Yes. So to the first question, we're still in negotiation phase, and I believe the Manitoba Labor Board will hear our evidence again. They'll receive our evidence, I mean. I believe the workers usually will get, at the most, they will get, what they miss in terms of wages. But I think we're looking for a higher win here. We're looking to get this, this will be publicized now because we won the case. We didn't negotiate with the employer to do a private deal. We didn't sign a non-disclosure agreement. We want this landmark case to really show the systemic nature of exploitation within the temporary foreign worker program, but B, also to be a beacon of hope for other workers who find themselves alone. Because this win is so rare, we really wanted to make sure that we highlight this case. The Occupational Health Center within the Manitoba Federation of Labor is such a great program. It was recently defunded by the cuts that Prime Minister Carney and the governing Liberals made, I believe, late last year or months ago. These rights workshops, which Migrante Manitoba has about 3 members who are train the trainers or trainers within these cross-cultural community program. We've utilized this funding to reach organizations, reach workplaces. Unfortunately, these programs are this program is now lost funding. We hope that will continue, but it's partnerships like this, like that we have with the Occupational Health Center, that make our organizing more impactful. So I'd like to invite anybody who has some kind of a program, has some kind of funding, or has some kind of a mechanism to help your local migrant worker or migrant justice organization. Please connect with the workers. Please connect with the groups. Migrantrights.ca, migrante.ca. You'll find groups in your area fighting for the rights and welfare of migrant workers. Please connect with them to see how you can help out.
Great, thank you. Let me address a couple of things quickly in here. There's a question about whether the practice brief will discuss roles, what different people in different roles can do, leaders, frontline workers, consultants. There is a little bit of that in there, and we can add more based on your question, so thank you for that. Another question, how would you find out what organizing groups exist? And the person notes that they're from a low population density area. So I can start with that, and then DY, you can add. We did a little bit of a cataloging of the organizing groups we knew and reached out to some folks, and so we have at least a partial list. I'm sure it's not complete, so feel free to reach out to me if you want to let me know where you are. I can see if we have any that are in your area. Generally, I would say this is kind of word of mouth. DY, I don't know what you would add to that.
Depending where you are, there is probably a Migrante at least active in your province. We're active in BC, Alberta, starting to get active in Saskatchewan. We're in Manitoba, Ontario, and Quebec. We don't have much eastward, but if you look at the migrantrights.ca website, which is the Migrant Rights Network, you might find organizations closer than you think.
Yep. I'll just comment, I see some of the stuff going back and forth in the chat. Yeah, I mean, my question about organizing and whether we need to organize within public health, when the comment about the occupational health in the U.S. and how there's a movement around that, we could organize here in Canada around that, and that would be helpful to really make some change. So yeah, that's exactly the kind of things that I hope this webinar sparks. Dio, you want to talk a little bit about your experience collaborating with unions?
Yeah, so the big collaboration that we've had over the past number of years is with the Occupational Health Center, which is part of the Manitoba Federation of Labor. We do get a lot of referrals from unions asking for assistance to help workers because of the huge barriers these workers face. Sometimes even with unions, like the case I highlighted with Maple Leaf, they are unionized, and they were still not able to convince public health that there was airborne transmission. I think the synergies between workplaces, associations, unions, and community groups is a very powerful one that we've not fully appreciated, not fully operationalized. We do have strong links to different unions so that we have access to um, some types of resources, maybe legal help. But yeah, even with the union, it's not a silver bullet. The work we do with unions is the beginning of the relationships that we have with workers. I don't want to underplay the how essential unions are. Workers, even migrant workers in unions, have better rights by far than most other workers. But because of the overarching cloud that the temporary foreign worker program has, it sometimes obscures some benefits that unions normally have. In Ontario, for instance, migrant farm workers are not even allowed to organize legally, which is such a travesty. So yeah, our work with unions is ongoing. We welcome collaborations and work, but it takes a lot of organizations to move the needle.
Thanks. Let me read off another question about vaccines. Again, for you, Diwa. I worked with the OPH vaccine booking line during the pandemic. I had a few calls from employers wanting to register their migrant workers for COVID vaccines. Unfortunately, language and access to a laptop or Wi-Fi were some of the problems I was hearing through the employer. Sadly, there were not many calls for migrant workers that I received. Do you have any data around the barriers faced and how many were unable to access vaccines by region? So I think your collaboration covered some of that, right?
Yeah, so we did a whole study on it in 2021 and 2022. I think there's going to be a link to a small report that we did in one of the international journals. Just very briefly, we found that especially in the southern Manitoba region, workers simply didn't have access because their employers didn't make it a priority, but also put it back up to public health. Public health didn't prioritize migrant workers who we already knew, even during the beginning of the pandemic, were more susceptible to the virus. They had congregate living conditions. Sometimes the politics of their employers, especially the different farms that didn't believe in the vaccine. Unfortunately, that type of politics or that kind of understanding or misunderstanding bled into the real access and the real barriers faced by these migrant workers employed on these farms. That shouldn't be the case, but we've documented it, and there'll be more reports to come about our work with migrant farm workers accessing the vaccine.
Great. I'm going to grab that link and put it in the chat in a second. All right. Some more complicated questions. One question, are we going to talk about the impact of how the extremely wealthy impact structural oppression? Can this impact be effectively challenged at the community level? And so I'll start on that, and Diwa, you can add. I mean, I think The way I think about this is that we need to, and I said this earlier, we need to both think about building power and breaking power. And so there are things we can do to break the power of the wealthy, campaign finance laws, having them have less of an impact on our politics is one example of that. There are lots of different things we could do to limit the power of the wealthy, and I think I'd put corporations in that category as well. That's only one aspect. I think building community power is also a critical component as well. The cases that are like what Diwa talked about are one way we can fight back. Until we build our own power, we're not going to be able to change the rules that actually lead to the health outcomes that are so inequitable. Diwa, what would you add to that?
Just in general, and very quickly, like corporate capture is a real problem everywhere in the world. That's the one main reason why there's a lot of forced migration. In Canada, we're not immune to it. Corporations and the very rich definitely have their say. When I was organizing workers during the pandemic, I was also working as a courier, and I was delivering in wealthy communities. I was delivering robots that swim underwater and clean your pools during the weekdays. And on the weekends, I was helping workers fight for their basic rights and put food on the table. Because of the huge discrepancy between the situation of the rich and the poor and those who are marginalized, like migrant workers, I think it's important for folks like public health and for folks in the government to seek the advice, to seek the wisdom of organizations and community groups so that they can at least offset some of the structural barriers caused by the lack of agency that these workers have. Supporting these organizations and allowing us to have our agency really matters and is really effective in the long run.
Great. Okay. I just dropped a link to the paper that Diwa was talking about and there's an author on in the chat. The other thing I see some folks doing is sharing information about organizing groups that they know of in Canada. And so please continue to do that. That's great. I think that would be super helpful for folks to know. I'll read off another question. Community organizing, this is a little bit long, but community organizing is more important now than ever before. That's absolutely true. And to me, public health is inherently about activism, but community organizing, taking collective action, or protesting are now increasingly treated as hostile by the police, putting increased risk for those who participate and require no criminal record. How can we work with communities and even act with them when permitted without being criminalized for our actions? These are supposed to be basic rights, freedom of peaceful assembly, but have been weaponized against Indigenous groups especially. How do we move forward from here?
Great question. I think activism has been demonized. Workers in the global south, like the Philippines, actually have to leave the Philippines sometimes because of their threats to their life for organizing. Workers who are involved in union drives, for instance, are particularly affected. We have some Migrante members who came as refugees because their lives were threatened. They were imprisoned for organizing. Sorry, what was the last part of the question? I just lost my train of thought.
That's okay. Just like, how do we move from here? What do we do given that it is being weaponized and
yeah, sorry. Political education. We have to organize workers. We have to learn about our history. Anything that we received, be it maternal, paternal leave, was done through struggle, was done through activism, was done through protest. I could name so many things on the top of my head of how many gains that we've made because of struggle. And I think that's the key thing is learning about the importance of struggle, the importance of organizing, even just in our history, in recent history as well.
Yep, totally. And I agree with that. And I say two things. One is I think that there are a number of things we can do that are not risky. And so absolutely start with those. We have data, we have evidence, we have convening power. There's all sorts of things we can do as public health practitioners to support organizing. And a lot of the change that we want is not going to be data driven. It's going to be about struggle. It's going to be about protest. And if we preemptively give in to what what's going on, I see this happening a lot in the United States. We're going to lose. We're going to see more authoritarian rule, certainly in the United States. And we do need to struggle and protest. And so I think it's a great question, and it involves risk. But if we really want to fight for equity, we do need to be part of that struggle. Last couple of questions I see here. One, anybody know about migrant workers in the people organizing migrant workers in the agricultural industry in the Niagara region? Somebody put MWAC in the chat, the Migrant Worker Action Center. I think they might have folks in the Niagara region. I'm not sure. Diwa, do you know of others?
Migrant Workers Alliance for Change, I believe, MWAC. Justicia has been working with migrant farm workers in the Niagara region as well.
Great. Okay.
Justicia with a J.
Thank you. Perfect. Appreciating folks adding to the resources to the chat. Okay, and last question we have barely any time for. Wondering if any of the research led by NCCDH has uncovered practices for deep internalized public health policies and interventions when aiming to partner with community organizing groups. In your view, why might partnership remain an underdeveloped area of practice? Is it a lagging practice shift? Okay, so I would say it's a lagging area of practice because we want to think of ourselves as objective. We think about public health as being kind of a technocratic thing. As somebody else wrote in that they think of public health as being about activism, but I think the dominant view within public health and the fact that many of our leaders are doctors makes it a very individualized practice that is about data and lab-based stuff, and it's not reflecting public health's roots, which were really totally embedded in activism. And so we've forgotten that, and we're now no longer allowed to practice in that kind of way. So I think that's a big part of it. And maybe I'll just stop there since we're at the top of the hour. And I want to thank you all for coming. And Diwa, again, very, very appreciative of you being here and all of what you shared. I think it was great. Really, really love it.
Thank you. It was my pleasure.
All right. Thanks, everybody.